Hello, welcome again to the monthly webinar series from the Mold Pros. This month we have Dr. Diane Mueller, who practices in the Denver area. However, she does telemedicine throughout the country, so she covers a lot of different patients throughout the area. So I'm really excited to have Dr. Mueller here with us. And today we're going to be discussing how mold can affect the gut. Because obviously through my experience, I've seen a lot of patients with IBS symptoms. But once we can get rid of the mold and the mycotoxins, a lot of those symptoms start moving away. So we'll start we'll kind of focus on that topic today. So Dr. Mueller, why don't you give us a little bit of background on yourself? How long have you been practicing? How did you get into this area?
Yeah, thank you. So I've been practicing now for 12 years in this mold and Lyme field. And largely, like so many of us that get into these kind of complicated chronic conditions, it was due to my own illness. So those that have heard my story hear me talk about how I had mold illness so bad that I was getting really scary symptoms, like a lot of cognitive decline, where I was forgetting where I lived. I would leave and leave my house and only be a couple blocks away from my house. And I would have this almost this fog come over and I would get dissociated for just usually like 30 seconds to a minute, but I would lose track of space. If I was walking, I'd have to sit down. If I was driving, I'd have to pull over because I didn't know where I was. So a lot of really scary stuff like that. At one point, I was having a difficult time walking. I would sometimes have to be carried upstairs. So it's definitely pretty severe. And in relationship to our topic today, I also had really severe chronic constipation, IBS that nobody could figure out. And mold, there's a lot of components to that. And we'll talk about some of the vicious cycles today that I was in that I think a lot of our clients get into. But there's that real big relationship from mold and in relationship to the gut with my own health.
That's so then, but you're a doctor here, so you were already you were already practicing medicine when you came down with these symptoms?
It was actually in the middle of medical school. So that was what was tricky about it, because initially with, chronic fatigue and fibro and some of these things, it was just kind of pushed under the rug, so to speak, because it was just thought that it was medical school syndrome, right? So I was tired, I was exhausted, I was studying till wee hours in the morning. So it really wasn't until I graduated and I started seeing my colleagues making a rapid improvement in their energy and reporting that, and I was going the other way. And that's really when it clued me into the fact that something was going on. So that's when I started running tests like mold and Lyme, these chronic other conditions. I had already done all the basic tests in school, adrenals and thyroid and SIBO and those types of things. And I'd worked on some of those things and some of them got better, but a lot didn't. And once I was clued into the mold picture, that was a huge missing link of my puzzle.
Awesome. So before we dive into our topic here, one of the questions I get a lot from clients that have been experiencing these mold-like symptoms is, I've been dealing with these symptoms for 5, 7 years, 10 years. Is there a way to get better? And it sounds like from your personal experience, there definitely is.
Yeah, I definitely believe in the human's body to heal. And I've seen pretty amazing things from a healing perspective. I've also seen that if once mold illness progresses to a certain point of neurological decline, it can get harder and harder, right? So it's I've seen mold illness linked to things like ALS and MS and some of these severe things. And there's some really cool research. There's a really cool animal study that came out in relationship to Alzheimer's and was actually showing that with Alzheimer's in animals, in mice, when they were subjected to light and sound at a certain frequency, it was activating the glial cells, the microglial cells in the brain, and cleaning up some of the trash in the brain. And what these studies were actually finding is with Alzheimer's, the plaques were actually reversing. And so I do really believe that in science and technology, even if mold illness has progressed to a certain point, that we are going to continually come up with new innovative techniques and science that are going to help us, reverse even these severe diseases. And right now, it's also one of these things where I just encourage people to take this seriously, to get out of the moldy home, to use, yourself, to use the Mold Pros to thoroughly remediate, because it's preventing these types of diseases that once it's progressed that far, it's not that it's not possible to reverse, but it sure is a lot harder.
I completely agree with that. I mean, the kind of like with smoking, I mean, the longer the person gets exposed to those type of things, the harder it is to make a reversal, but not impossible. So let's try to get into our topic here. Let's break up into like a couple of different groups here. Let's first go into like diagnosis, and then we'll follow that with like treatment modalities here. So when you have a patient come in, they're like suffering from like gut issues, how do you kind of like progress with those type of patients?
Yeah, I mean, if they're suffering from gut issues, I mean, I think with any type of issue, the biggest thing is getting the full picture. It's like a really frustrating thing, I think, with what conventional medicine is doing right now. And I imagine you've seen this in your clients, where so many times people have to go to, say, a conventional doc with like one symptom. And if they have a symptom in their gut, they can't also talk about the fact that they have chronic fatigue or brain fog, because they have to make a different appointment for that, right? And that's a really frustrating way we've started practicing medicine conventionally, because in answer to your question, when people come in with these gastrointestinal related symptoms, it is important to get, that history, right? To make sure we understand what's going on. Is it bloating? Is it pain? Is it nausea? Is it burning? Whatever it is, and get that symptom picture. But then it's also really important to make sure that we are connecting that to chronic fatigue, into brain fog, into headaches and migraines, and really asking all those questions. If somebody truly has, I don't find this frequently, but if somebody truly has, say, like constipation and only constipation, and that is their only symptom, which is, I find to be rare, then I tend to find that most of the time that really is just a GI related problem. It's a parasite, it's a SIBO. There's not a wide variety of testing that needs to be done beyond that. But 99.9% of the people I see, that's not the case. That it really is, it's like constipation plus things going on neurologically, things going on all over the body. And that's when it really becomes important to make sure we're doing our stool cultures, our SIBO tests, looking for intestinal permeability in foods, and all the gastrointestinal related tests, but then also thinking beyond the box, outside the box, thinking about toxic metals, which can play a role in that, thinking about mold, which plays a huge role in that, thinking about chronic hidden infections, which can also play a huge role in the gastrointestinal related diseases as well.
It sounds like, I mean, is there like a one test that you run at first, or do you have like a panel of tests that you normally run on these type of patients?
Yeah, I mean, we definitely tend to individualize it as much as possible, but there are some, some standards. Like, so one of the things that gets so complicated from the mold perspective, I find, really is the testing from inside the human body. So it's like we have our mycotoxin test and the mycotoxin urine test. And I think those are valuable. It's kind of great to actually see what toxins are actually coming out in the urine. But of course, that doesn't really differentiate between a true pathological process versus a normal physiological detox process, because somebody that doesn't have a mold problem encountered mold once, and now it's coming in their urine because they're just detoxing. So we do use those, but then we also use some of the inflammatory marker tests that Dr. Shoemaker developed, our HLA-DRs, our TGF-beta-1s, our MMP9s. So those blood markers to also help us more look at the inflammatory process that's seen with mold. And then from the GI perspective, most commonly we order a small intestinal bacteria overgrowth test. And I like people to be aware from the gut perspective that it's super important that we are doing like a 3-hour test and not the 2-hour test. Some companies and hospitals are still using a 2-hour test, and you can miss some of the positive findings if you do a 2-hour test and not a 3-hour. So that 3 hours is really important. And then secondarily, the other huge thing with the SIBO testing is making sure you're using lactulose instead of glucose. So with SIBO, it's small intestinal bacteria overgrowth, right? And so it's like that lactulose versus glucose, for people that are listening, really is about giving a sugar that is essentially going to feed the microorganisms that are in the small intestine, and they'll ferment. And then we test for the abnormal gas production in your breath for that fermentation. And so some testing companies are using glucose. The problem with this is that glucose feeds and is absorbed in the small intestine, in the upper part of the small intestine. So if the overgrowth of the bacteria is in the lower part of the small intestine, that glucose is absorbed in the upper part as that provocating agent to feed the microorganisms and produce that gas. If the glucose doesn't make it to the end of the small intestine, it's not going to feed the microorganisms. They're not going to produce the gas, and it's going to look negative. Versus lactulose will make its way throughout the entire small intestine, feed the microorganisms in that later part of the small intestine. And then when you get that, you'll actually get that positive gas. And so it's going to be a more accurate test. So, just for everybody that's listening, just, it's really important that you're not just saying, okay, well, SIBO across the board, that you're getting that 3 hour, you're making sure it's lactulose driven. That will make a big difference in making sure your testing is accurate.
That's a good point. I mean, you could definitely this, because two tests have the same name. Not all tests are created equal, because of methodologies behind the test, and understanding the methodologies behind the test is extremely important. So you run these tests here, and you get positives on, let's say you get positives on the urine mycotoxins, and I wouldn't be surprised if you get a positive on the SIBO test either, because of a lot of these mycotoxins have abilities to lower the immune system. So through my research, I've seen, and I know other people have seen this as well, is that you get a co-infection with a lot of bacteria, especially in the small intestine, when you have mold, a high mold exposure. Now we have to understand, people have to understand differences between, everybody's exposed to some type of mold, and understanding, being able to look at like you said, talking about looking at the urine test, being able to distinguish between what is a normal mold exposure and what is an abnormal mold exposure is sometimes a little bit tricky. And what's even more tricky is figuring out those patients that have abnormal mold exposure but aren't excreting toxins. Those are some of the trickiest patients I've seen. Do you have a lot of experience with those type of patients that you know that they've been exposed to something but really aren't showing it on some of the excretion tests?
Yeah, and that's where I think the benefit of doing not just urinary mycotoxin tests, but looking at some of these other markers from an inflammatory standpoint can be valuable, because there's definitely people like that with such a dysfunctional detox system. And it's a really interesting and kind of perfect lead into this, this topic on vicious cycles between the gut and mold illness. Mm-hmm. And I find, it's in medicine, I find that there's just so many vicious cycles, and the vicious cycles are almost like the chicken and the egg. It's what came first? And it's just we get into the cycle where we can't get out of it because the one causes the other, but the other causes the one. And we're just doing it like this. And so one of the things I see from a gut mold relationship in regards to what you're talking about here around exposure, but you're not finding in the urine, you're not detoxing, is if somebody does have SIBO, so if we have a small intestinal bacteria overgrowth, or if we have a huge growth of pathogenic E. coli in our large intestine, for example, those types of bacteria that are gram negative will secrete in there, and especially when they die, lipopolysaccharides, LPS. And a lot of people have heard of those, but how this is related to detox is we have the process of detox. So I'm going to go backwards and I'll tie this all together here. So the process of detox, basically, a lot of people understand that we detox in the liver goes through the process of breaking these toxins down, the liver excretes them, puts the toxins into the bile, and essentially our goal is to poop out our toxins, right? And so a lot of people understand that level and will focus detox on improving the liver function, on doing things like binding the toxins in the small intestine or in the large intestine so that we can poop them out, that sort of thing. But a huge missing link with this whole picture, and what's not talked about a lot, is when the toxins are broken down in the liver, we actually have to transport them out of the liver. And so we have a couple of different transport proteins to do that. So one is called the BSEP, and the other is called the MRP2. And these proteins need to work, and we can detox all we want, but if these proteins aren't working, we can't get the toxins out, and still the broken down toxins will back up in this situation to systemic circulation. So now to tie all this together. So back to our SIBO and our small intestinal bacteria overgrowth conversation and our secretion by those bacteria of that LPS, that lipopolysaccharide. What winds up happening when we have that lipopolysaccharide increase is that LPS can actually turn down the MRP2 and the BSEP transport proteins. So when that happens, then guess what? Then we're not transporting the toxins out and they go back into systemic circulation. So this is one mechanism behind why what you're talking about here, like somebody has exposure, we're not seeing these toxins in the urine, we know they're there. Well, SIBO or, and other gram-negative type of situations in the body, that's a huge reason that can lead to not being able to secrete these things in the urine.
Yeah, so let's use that and transition to, you kind of touched on it before, moving from diagnosis to treatment. So you kind of talked about we get a lot of toxins building up in the liver. What are some of your protocols that you normally do to push those from the liver, support the liver to push those toxins out and into the bile? Because obviously some people that have a lot of toxin issues don't produce enough bile acids. So what are you doing for your patients to help with that process?
Yeah, so there's 3 nutrients that can really push those proteins to work and also have the ability to push more bile. So the transport protein upregulators, as we call them, improving the function, are myrrh, phosphatidylcholine, and TUDCA. And typically I find that some people will be able to respond better to one versus another. So I have some people that do really, really great on myrrh. The moment you put them on choline or TUDCA, they will herx. So it's very rare I have people on all 3, although sometimes people do well with a combo. But typically those are the 3. And very frequently I will start with 1 or 2 of those at the very beginning of detox, actually before I do binders, before we do things like glutathione or ALA or NAC, some of our liver support. Is really just getting those pathways open, because it's kind of this principle. If we don't have the pathways open, if there's a blockage, we can start moving all we want, but it's just going to go backwards if we don't have things open. So really starting with those 3. And the other thing that's super interesting from just kind of opening things up from a treatment perspective is this BSEP protein, this bile salt transport protein. We also have this transport protein in our brain. And it's in our brain because in part, we want to get cholesterol into our brain because cholesterol is so, healthy for our neurological system. And so basically we also get toxins into our brain frequently. So also improving the bile salt export protein, the BSEP protein at the brain level by using, the myrrh, the choline, the TUDCA is also going to open the pathways to allow the brain to start detoxing as well. So that's usually step number 1 before anything else. And some people, it's when we're talking about dosing, the biggest thing around dosing I encourage people to do is start super small. It's we can talk about full dosing on all of these, but in the grand scheme of things, it really comes down to what you can individually tolerate. And oftentimes the really sick mold illness people, I have them opening capsules and just dipping their finger into a tiny little bit of the powder from one capsule and doing that 1 time a day to start.
That's a good, those are all great points. So, you talked about supplements and you talked about, is there any, so talked about a couple of different transport proteins. Do you like, I know in my like research, I've like, and I encourage certain like doctors to also encourage their patients to give some supplements to upregulate some of these transporters. If you do you, so I'm sure you're aware of the like the Nrf2 pathway and keep one. And so do you like recommend your patients to ever take any supplements to help like activate that Nrf2 pathway?
Yeah, certainly from that standpoint, using our antioxidants like resveratrol and curcumin, and then using things like glutathione can be huge for those types of pathways. So I don't necessarily specifically say, I would say like target using a product like there's like Nrf2 activators, right? So I don't specifically use that, but a lot of what we're doing anyways within the context of detox by supporting antioxidant health, by giving glutathione, by, really doing that is supporting that Nrf2 pathway anyways.
Yeah, I mean, glutathione is definitely a byproduct of the Nrf2 pathway. One thing I always like to do is like, I mean, it's a very simple thing for patients of like, one of the biggest activators of the Nrf2 pathway is actually organics in green that's been found in like a lot of different green tea pathways. So it's just an easy thing for like for patients to do is like drink like 2 glasses of green tea a day. It's been shown to like increase the Nrf pathway by like 40%. So this is an easy thing for a person to do on top of that seems to like have like increase the efficacy of the other like things that you are recommending.
Yeah, absolutely. Absolutely. And I think the grand thing of that is like lowering the inflammatory process that is associated with die-off, is a huge, portion of that as well.
So let's talk about that a little bit there. So how do you decrease the inflammatory pathway? Because obviously, like I'm sure that you've like, I mean, so Robert Navio talks a lot about the cell danger response and how, I mean, inflammation plays a big role in that. So how do you try to decrease inflammation in your patients?
Yeah, honestly, so much of it I feel like is getting to the root. So that's a huge, huge component of like, I think so frequently we focus so much on, on say just mold illness. Like I have so many people that come in and they're like, okay, well, I've been on binders and these things for so long, but we're actually not looking at the small intestinal bacteria overgrowth and the parasites and the intestinal permeability. So some of inflammation I find, it's like we'll give anti-inflammatory sometimes, and sometimes we'll use things like CBD, those types of things. But in general, I find that for most people, getting to the root is the best way of solving the inflammation. The other couple of things that we've seen to be pretty pivotal, one is really working with the lymphatic system. So we teach most of our clients just like home lymphatic massage, which sounds pretty simple, but it is one of the most like responsive ways I have found that people that are herxing, that are, responding poorly to treatment can actually get movement, because it's not a supplement, right? We're just helping the lymphatic system. We're just helping the drainage system of our body work better. And honestly, the other biggest thing that I've seen with this is mindset training, is really working on lowering that cortisol and adrenaline response of the body. And in doing so, I've seen inflammation calm a lot by working with the mind. And so the mind component of this is a pretty interesting topic, because I think it's like another vicious cycle we get into with mold illness and with chronic disease in general, where we feel bad and all of a sudden we think, our mind triggers thoughts and behaviors that are oftentimes pathologic, right? It's oftentimes thoughts like, I'm never going to be well, this sickness has ruined my life, like normal thoughts to have.
Yeah.
But we can spin ourselves into like a sympathetic dominance of fight or fight overdrive. And from an inflammatory, perspective, and from a herx perspective, one of the biggest things that I've seen help people is, beyond any supplement, beyond any medication from that standpoint, is really teaching their nervous system to stay calm, and really spending a lot of time working on the mindset and the mindfulness component of things.
That is great. I mean, and I think that, and luckily, I think it's in the last like 2 to 3 years, I feel like that's really became more and more of an emphasis, and I think it's probably, yeah, well, that's one thing that traditional medicine totally like misses is the brain part of how it controls the body. And if we try to separate the two of them, like, oh, we got psychologists and psychiatrists for the brain, and we got physicians for the rest of the body, and try to like separate the two of them out seems to be that we're doing a disservice to our patients that way.
Yeah. Yeah. 100%.
So we talked a little bit about inflammation, and we talked a little bit about how like on your like when you're talking about your SIBO testing, you using glucose or using a lactose base instead of glucose base because of the bacteria in the gut. So what kind of diets do you recommend to your patients because of, especially like if you have like you could have mold, or you could have bacteria growing in the gut. A lot of these pathogens like really high sugary diets. So do you like do like a modified diet for any of your patients at all?
We definitely talk about food a lot, and my answer is probably going to be a little bit annoying to some of the listeners. So I know so many people want this like perfect answer, right? But in the grand scheme of things, what I've seen from a dietary perspective is it depends. It's like some people I've seen, it's like putting some people on a keto diet, for example, can really help with their cognitive function, can really help stabilize their blood sugar, which can help him have more mood, better mood and more energy and all these things. And I've also seen keto diets really tank people's thyroids, and then their thyroid crash, and then they have no energy. So it's an example of like how individualized I really think diets, are. And so a lot of the dietary suggestions, which we make for every single client of ours, really comes down to understanding their full picture. Like even somebody with SIBO, some people will talk a lot about the SCD, the specific carbohydrate diet, or the FODMAPs diet, or the GAPS diet. These are all common diets for SIBO people. Yeah. And I have found that they can really help alleviate some people's symptoms. And for other people, all they need to do is eliminate one or two foods from that, and the rest of the dietary world can be open. And I would say the most common diet I put people on from a mold illness perspective really is a low histamine diet. Mm-hmm. And so that would be the most, because I do find so many people think they have MCAS. Oftentimes I find that MCAS is a little overdiagnosed, and it's really just a histamine intolerance where their histamine level is high compared to, how much is being excreted. But regardless, whether it's mast cell or histamine intolerance, it's still, for so many people, there's a mold relationship with increasing the histamine load in their body. And, to circle back to the inflammatory component, getting histamine under control using diet and sometimes using supplements too, I find to be a huge thing for a lot of people with their symptoms. So if I were to say there's a diet that is most common in this population that I use, it's a low histamine diet. And that's where I think it gets complicated to say, okay, well, we combine low histamine with FODMAPs or low histamine with SCD or keto or whatever we're doing. It gets to be like, I don't really like the idea of having, people only able to eat 7 foods. So we tend to figure out, okay, well, what dietary strategy is the best for this person, but still allows them to eat.
Do you ever or use like a food sensitivity test at all for your patients? So
I do. Yeah, I do. It's tends to be not the first thing I go to for most people, because most people have such intestinal permeability. And, we see evidence that like ochratoxin and trichothecene, some of our mycotoxins, there's direct relationship with those types of mycotoxins actually causing intestinal permeability.
Oh, yeah.
And so, when we have situations where it's like, it's early on in somebody's disease process, typically when I've used food sensitivity tests, people will come back and they'll be reacting to most foods. Mm-hmm. And it's like, it's kind of, gets to be just a life type of nightmare to say, okay, well, you can only eat, like I said, like 7 things. So I do use those tests, and I love those tests. And I think there's a lot of value in clinical utility in those tests, but I tend to find that that's a little bit better once we've done things like detox the toxins, fix any of the SIBO, any of the parasites, heal the intestinal permeability, and then, go back and run those tests at that point, because then at that point, we typically find people are reactive to maybe 5 foods. And that to me is like, not a less of an intestinal permeability thing and more of like, oh, this is truly an immunological thing.
Mhm. No, that's a really good, those are all great points. I completely agree. What other topics have we missed here so far? I'm sure I've missed something. Which else should we cover?
Well, I mean, I think just more on the relationship with these individual toxins and gut health. So like ochratoxin. So ochratoxin can cause intestinal permeability, but another thing that ochratoxin will do is it can actually lower the gut microbiota population. So it can lower things like lactobacillus and bifidobacteria. And this is where we get to like this subsequent chain reaction of events, right? So we have a lowering of those microorganisms. Then one of the things that can happen is we can get a lowering of short chain fatty acids.
Yep.
So, right. So short chain fatty acids are essentially these nutrients, right, that these good bacteria in our gut will create. And they do a wide variety of things. So like short chain fatty acids, like one short chain fatty acid is butyrate. Well, butyrate is used as one of the energetic fuel sources for our colonocytes, for the cells of the colon.
Mm-hmm.
So it's like we have ochratoxin leading to a problem in these mycotoxins, lowering of the mycotoxins, lowering of short chain fatty acids. All of a sudden the colon doesn't have the energy to do its job properly. And then we can get subsequent, say, problems from a motility standpoint, maybe it's constipation, maybe it's diarrhea. And so we can get in this example, we can get the toxins creating the gastrointestinal problem.
Yep.
But then once we have the gastrointestinal problem, one of the things is like, well, then binders might not work as well because somebody's already constipated and they can't take binders. And then the mold gets worse, and then it stimulates a worsening and lowering of the microbiota. And so that's one of the vicious cycles I'm talking about, that we can just go round and round and round and round. And, from a treatment perspective too, with that, it gets to be a little bit complicated from, some, people are always wanting treatment order, and treatment order is like, I almost look at treatment order in these situations where it's like, okay, we have our mycotoxins, we have some sort of short chain fatty acid issue, we have a normal flora issue. And it's a little bit like it's almost like say a wheel, and the center of the wheel is health. And we have all these different spokes, and the one spoke is mycotoxins, the other is bacterial, imbalance in the gut, et cetera, et cetera. And really in the grand scheme of order, like there's again, like commonalities and places. And, for those of you guys that have read my book, you'll see this in my book that I lay out like the most common treatment order. But in the grand scheme of it, the reality of it as a clinician is people do respond differently. And it's about just, sometimes a little bit of trial or error to say, okay, what spoke is going to be the spoke that is unique for your body, that has so many cell danger response types of reactions, like you mentioned, so many different things happening. So what spoke is actually going to be the one that is going to calm your system down and let us in so that we can get you out of the cycle. And so we can honestly, when we're in the cycle, we're in that vicious cycle, we can start the treatment really at any spoke that your body is going to let us do. So that's just, I think that vicious cycle is a really, really important component of this gut mold reaction that is important to mention.
That's a great point. And one thing that I've always heard from a lot of patients and practitioners is, so I think it's important to find a practitioner that you trust, but also don't get disheartened the first time you that practitioner tries something. Because like you said, you could try one thing and it works for 70% of your patients, but it might not work for the other 30%. So trying to figure out what works for that other 30% is sometimes the harder part.
Yeah, I think we see this in conventional medicine too, right? We see that just because something, even a surgery, helps one person, excuse me, I have something in my throat all of a sudden. Just because we have something that works for one person from a surgery perspective isn't going to work for, say, somebody else, right? So we see that whole concept in conventional medicine. And I'm really hoping the way that lab technology from a medical perspective eventually goes is I hope there's going to be a way someday to identify, like, if we have 10 root causes, like 10 things that are out of balance in an individual, like hopefully there'll be some lab that is able to develop some way of determining for the uniqueness of that person, starting at this position and with this root cause, with this supplement is going to be the number one way to go for the best results. And I think that's the frame that people come into, medicine with, of like thinking like, okay, we get these lab tests and now we're going to know the perfect, answer. But the lab testing, there is a limit in what lab testing can tell us. And it is not developed enough to be able to tell us that, okay, with this person with thyroid problems, adrenal problems, mold illness, SIBO, and parasites, which one of those areas we should start treating, first, which one is going to have the best results, and then which portion of the treatment within those root causes is going to be the best place to start. So we start, like you said, it's like 75% of people get results with going this route. That's where we tend to start as clinicians, of like the route that we see people have success with most of the time. And then we listen to the feedback from the body. And that's no different than, in many ways, what is done in conventional medicine with standard things. It's like somebody goes in for an autoimmune condition and they might get prednisone, they might get methotrexate, they might get a wide variety of different medications. And you continue to work on finding something until that medication is actually working for that symptom. And so it's very, very similar, in the root cause base. The difference is we're really looking to figure out the root and not just cover up the symptoms.
Exactly. I think those are all good points. Well, I try to keep these around 30 minutes. So do you have a website? What's your website that you have?
Yeah, my website is medicinewithheart.com. And so that's our clinical website. And that's where you can find us. We do telemedicine. We work with people all over the world. So that's very easy to access us. And then we also have a practitioner training program where we train clinicians in mold illness, in Lyme disease, as well as in basic things, gut health, thyroid health, adrenals, cardiometabolic. So you can find us there at mindbodyfunctionalmedicine.com.
Awesome. And you have a book too? And what's your book's titled?
Yeah. The book is Use Your Mind to Heal Your Mold and Lyme. You can find it on Amazon. And it is, we kind of emphasize mind in the title because of the component of the mind being kind of a huge missing component of working with mold illness and Lyme disease. But it is really, the book is really a mind-body approach. So we go through a lot of the process of how we find the root causes, as well as the treatment perspective and the most common treatment orders, and then also work on how to really change your thoughts, how to get into more of a parasympathetic healing type of nervous system state, and more. So that's on Amazon.
Awesome. Well, thank you very much for joining us today. You're one of our premier practitioners, and I just love that you are affiliated with us. Thank you very much for your time, and we'll hear from you in the future. Thank you very much.
That sounds great. Thanks for having me.
Thank you. Take care, everybody.